Welcome to another episode of the Gut Health Dialogues podcast. Today I have a very special guest, Nelin Krull, and she is the co-owner and clinical director of Myofascial Release Mississauga. Nelin completed her Master's of Science in Physical Therapy at the University of Toronto in 2011. Upon graduating, she was attracted to the fast pace and acute nature of patients in the hospital setting. For 6 years, she worked as a physiotherapist in Credit Valley Hospital in various areas, including surgery, medicine, pediatrics, obstetrics, palliative care, oncology, and emergency. After the birth of her daughter, the pace of the hospital didn't fit with her young family anymore. So Nelin joined her husband Justin on a path to entrepreneurship and began to pursue her dream of owning a practice together. Her goal is to help people suffering from chronic disease and chronic pain improve their quality of life through education, lifestyle changes, and myofascial release. So welcome, Nelin.
Thank you so much for having me.
I'm so excited to have you on the podcast because I have been very interested in the last few years in specifically visceral manipulation. That's how it started for a lot of my SIBO patients. And that's how I found you. I was looking for somebody to help my audience understand more about visceral manipulation. And on a personal level, then I also stumbled upon myofascial release. So I actually have an issue with right hand weakness that's related to tension somewhere up in my neck and shoulders and maybe my brachial plexus where they meet. And so I'm still on a journey to really fully resolve that and have looked into myofascial release for my own structural muscular issues. And then in my conversation with you, you were sharing with me that it actually has applications to gut health, which blew me away because I'd never heard that before. So maybe you could start out by just starting with the basics. We will talk about visceral manipulation, but can you explain what is myofascial release in general and how does it differ from other types of physical therapy?
Yeah, for sure. I think in order to be able to answer that question, first I need to give you a better understanding of what fascia is. So that's the basis of all myofascial release. So the fascia is an interconnected web of connective tissue. So I like to think of it like your intranet, essentially the web that connects every single cell type and tissue type in your body. So it would connect your brain tissue, your blood vessels, your nerves, not just that, but your muscles, your bones, all of those things. And because of that, it creates this system where every single other system in the body, when you think about the digestive system or the nervous system or the cardiovascular system, they're all connected. And every single cell is connected from head to toe. And when you think of the fascia like that, it creates this ability to see things in ways that maybe typical conventional physical therapy might not, where physical therapy tends to look at things in compartments, right? And so does a lot of the medical system. We look at things in compartments. That's why we have these various systems like the digestive system and that's separate from the nervous system, et cetera, et cetera. Myofascial release comes in where we have these issues where we have fascial restrictions in the body that are created by various things. They can be created by obviously physical injury, but also emotional traumas and things like that, where the fascia, this web of connective tissue, becomes very stuck down. I like to use the analogy of bubblegum in hair. So that sort of stuckness that you feel in your body, that's that bubblegum that's got all tangled up in the hair. And in order to be able to release that, what's required in order to take that bubblegum from being so sticky and so viscous and really holding on to that hair or the fibers of your connective tissue is to be able to melt it, essentially. What we're doing is we're applying gentle, low, prolonged pressure to force that tissue, essentially, to go from this very sticky, viscous thing that's holding your hair to more of a liquid. So now your hair can glide freely. And that's exactly what your connective tissue does in your body. You have these sticky, viscous restrictions, and then we release them. And then all of those fibers can glide and move freely as they're supposed to.
Wow. So the bubble gum, is that adhesions?
Yeah, so essentially it is the ground substance or the fluid that all of our cells and your fascia live in. So that would be your interstitial fluid. It goes from being very liquidy and everything flowing really nicely to this very sticky, thick, viscous substance that our cells are now being stuck in and our fascia is stuck in so that we can't move as fluidly.
Okay, so the interstitial fluid kind of turns sticky. That's so interesting. I did have a physical therapist tell me if you don't move like every 30 minutes, like that's how quickly basically adhesions can start to form, is if you're still for more than 30 minutes. So the idea is don't sit still for long periods of time. And it's so interesting that you said emotional trauma, because for one thing, with digestive issues, we know that a lot of people with digestive issues have emotional trauma in their history or some form of stress. We all have stress. Our modern lifestyle leads itself to that. And I know with my issue, I'm going to probably be talking about my issue throughout this because it's really helped me to understand this concept of also what's happening in the gut. Because like you said, the body's all connected. I know that with my issue, when I'm rushing to type, the hand gets even weaker acutely in that moment. And if I can relax, then it must be opening up the nerve signaling in that moment when I'm able to relax. So that's for me a very stark example of emotions and how it's tying into that tension. Does that make sense to you?
Oh, yeah, totally. Yeah. So we see facial restrictions as a result of habitual patterns, sitting for long periods of time, or having that regular routine that we do of like getting up, getting in your car to drive to work for 20 or 30 minutes, wherever. Those things can create facial restrictions of the body just as much as an emotional trauma can or a physical trauma.
That's so interesting. So we have fascia then in our digestive tract as well, right? Because it's the connective tissue that connects everything. I'm curious, is fascia something that shows up in a scan?
No, not unless it's become like really out of control. So if you think, for example, like something like a scar, where we or your body has laid down many layers of additional connective tissue and it's all tightly adhered down, you might see something like that on an ultrasound, for example, which is better at visualizing soft tissue. But x-rays, no, you're not going to see it on the CT scans or MRIs because these are small things that we're talking about. When you have something as big and adhered down as like a scar, for example, I have a C-section scar that's been cut through twice. It is pretty significant. And so you might see that. But the fascial restrictions that bother us day to day, those are the sorts of things that you're not going to see on imaging. It's more of a felt sense with the patient, but also with the practitioners who are trained to look for these restrictions.
Okay. And one of the things that I tell all of my patients who have SIBO is small intestinal bacterial overgrowth. And it's a condition where basically bacteria overgrows in the small intestine. And it's a result of the small intestine not being able to clear itself for a number of various different reasons. But one of the reasons is adhesions and scar tissue. And so I go through the history of all of my SIBO patients and find out all of the different things that could have predisposed them to SIBO. But any type of abdominal surgery, like you said, a C-section or hysterectomy, appendectomy, things like that, which is so many people, that is something that sends bells off in my mind. And so I recommend that they pursue visceral manipulation. What would you say can be done in those situations to help? Because if you have adhesions that are then causing pockets or little corners in your intestines so that the food and bacteria is not able to move through smoothly, then it can get caught up. Bacteria can build up in those little corners. And that's how we get SIBO. So we can do antimicrobials, we can do all the gut healing we want, but if that's still happening, the SIBO is just going to keep coming back.
Yeah, and that makes sense. It's not going to be able to reach those little pockets where things are secluded almost from the regular flow of the intestinal system. And I think that's what it comes down to, is that the whole purpose of myofascial release is to restore movement and flow, whether that be physical movement of the way the digestive tract normally moves, or it could mean the blood flow to those areas or the nerve conduction to those areas, like you were mentioning with your hand before. If you think of the fascia as the sort of scaffolding of the digestive system, and particularly the small intestine, if there's an area where we're creating constriction because of either adhesions from a a surgical procedure, or like I mentioned before, it could be restrictions that have been created because of an emotional trauma that's happened. A lot of us feel emotional responses in our bodies, like when people say they have a bad feeling or they have a gut feeling. We store a lot of that emotion and a lot of that trauma, oftentimes in our digestive system and also up in our thoracic cavity. When we think about a restriction in that area, that's like physical, maybe even tightening of an area or constriction of the actual structure of the small intestine. If we can release that and allow it to open back up and be a little bit more smooth so we're not creating these pockets, then yeah, that can absolutely help with symptom relief.
With symptom relief and then also for relapse prevention, that's how I screen people for, should I send you to go get this looked at? What are some of the other ways someone might be able to tell if fascial restrictions might be contributing to their gut problems?
Yeah, so we often share with our patients a quick body scan take. So it's just essentially teaching them to be able to go inwards, become more attuned to how they feel in their bodies, and look for sensations that don't necessarily fit with like what we might think of that we'd feel in our bodies. So it doesn't always present as tightness or stuckness or something like that. It can sometimes feel just weird. You might feel a sensation of heat. You might feel a sensation of cold. You might feel a sensation of vibration or just a heaviness. And so, but by doing a body scan, it's really just similar to a meditation where you sit down in a quiet space, close your eyes, go inwards, and feel where you feel sensations and what they come up as for you. And wherever you're feeling, that's usually where the myofascial restriction lives and where you could focus your treatment techniques.
Okay, so if you do a body scan and you feel something, that would be a clue. Is it possible to have them and not really be able to feel it?
Yeah, it's possible that where you're looking is maybe not the right place, in the sense that, let's imagine that we're talking about somebody with SIBO. They probably have irritation of the gut and some pain symptoms and weird sensations going on in the gut for sure. But for someone who has gut issues but doesn't really feel super symptomatic at rest, if they're not doing something that's triggering, they may actually feel sensations in different areas of the body that are contributing. And because everything is connected, something like a restriction in the pelvic floor could create enough tension through that area of the small intestine to create similar symptoms to what we might see with SIBO. Chances are good if you're not feeling anything, it's maybe because you're not looking in the right place and you're intentionally focusing a little bit too much on just the gut when you can look for sensations more globally.
Okay. For my patients who are really suffering with pain and discomfort, especially to the touch, I'll wait till we have cleared enough of the bacteria and calmed inflammation down enough that they feel like they could go in and be touched without making it worse. But yeah, that makes sense what you're saying. So for people who are listening and might be dealing with these issues, what does a typical myofascial release session look like?
Yeah, so we as trained therapists will take your history as to what you've been suffering with, and we'll also put our hands on you to find those areas of myofascial restriction, because we're trained to feel those areas of heat, tenderness, that sort of sensation of really firm tissue or vibration or whatever it is. And then we put that together too with how you present in front of us, because as we know, we all live in gravity. And so anywhere where there's areas of restriction will create altered lines of tension. And that's going to show up when you're standing in gravity. We're going to see those shifts in terms of posture and alignment. And so we just we amalgamate all those things together and just decide where things look like they need the most work. And oftentimes it's not where people are symptomatic, it's usually somewhere else. If you have symptoms in the gut, you may also have like a really clear pattern of restriction in your low back or your pelvic floor or in the hips, somewhere that also pulls into that area of the gut. And so we might start there, actually. We may not even get right into what is typically considered visceral manipulation, where we're finding those areas of restriction within the sort of organ structure. We might start elsewhere and then work our way in. And so whenever we find a restriction, we'll apply gentle pressure to that area for a minimum of 5 to 10 minutes. So it really is a long treatment. It's not a quick sort of aggressive motion, because we want the body to A, accept the fact that it's being worked on, and then B, feel ready to let go of whatever it's holding on to. We do that in whatever areas that we find for at least 5 to 10 minutes, and then we reevaluate and look at the body and say, where is it telling me it wants to go next? Because especially for anybody who's been living on this earth for greater than 25 years, we've got at least that many years or more of fascial restrictions that have been building up over time. And so the body will show you, with respect to symptoms, you may even see it present as redness or patients getting flushed in different areas of the body. So that tells the story of, okay, first I need to release this, and then this, and now you can go here. Now this is the time you'll be most successful to go here. It's a bit more intuitive. It's not super protocol based, but the beauty of it is because it's a little bit more intuitive and you're the one who lives in your body, it is something that we can teach you to do for yourselves as well.
Are there any self-care practices people can do themselves at home to complement what they might do in a session or get started?
Yeah, for sure. Essentially, it's really as simple as find an area of discomfort and either apply gentle pressure or stretch into that area for a minimum of 5 minutes. For example, if we were looking at the gut, we use what's called a myofascial ball. It is like a rubber ball, but it's filled with air, and it's about 4 inches in diameter. And the reason we use one that's filled with air is because it allows you to adjust the intensity or the tension that you feel when you lay on this thing. Because if you were to, for example, lay on like an acupressure ball or a cork ball, that's a very firm tool that your body may not want anywhere near it. And especially if you're using gravity to help you, if you're going to lay on it, that may feel very intense. So we use an air-filled ball so you can adjust the sort of squish of it. And yeah, you just put it between you and the floor and you lay on it. You lay there for 5 or 10 minutes, minimum 5, and then just feel what you feel. You don't have to roll around, you don't have to move anything. You just let it sink into the tissue and let it do its magic. And you can do that really with any area of the body, any way that you can find to take the ball and put it between you and the floor, or there's other areas of the body that are harder to do that sort of thing with, in which case we might recommend more of a stretch where we're using gravity again to pull down a limb to allow us to get stretch or that prolonged stretch in that area. It's really that simple. We do have lots of resources for clients to look for if they have a specific area of the body they're looking to treat and they don't really know where to get started. So we provide that to them, and then they just give it a try and see how it goes.
Yeah, so I have this lacrosse ball here. They gave me in the physical therapy center, but it's very hard. So that's more than what you're talking about. You're talking about something with more squish, right?
Yeah, especially for a beginner. You can use the lacrosse ball. What I recommend doing is just putting a thin pillow cushion or a folded up blanket between yourself and the ball. So that brings down the intensity. It releases that sort of like really focal intense pressure and kind of makes it a bit more diffuse. And your body's generally more likely to accept that and release into it. So if that's all you have, no worries. Definitely use that. You can purchase a myofascial ball from us, but if you don't want to do that either, there's lots of alternatives you can use. One of the simplest ones that we share with our clients is just to take the little square towels, the ones we use for our face in the morning. If you just take a couple of those and wad them up into a ball and just wrap them with a whole bunch of rubber bands, that sort of simulates that same amount of squish that we're looking for without flattening completely. And that would help as well if you're looking to get started and you're not really sure about it, but you want to give it a try.
Okay, that gives me a good idea of the softness. And so for people who have abdominal adhesions and they want to get started on that, would they lay on their belly or could they just press it into their belly?
That requires too much effort. The more relaxed you can be, and that is important because we want to make sure that our body's not bracing in any way, because if it's bracing, then it's not going to let go. The more you can use gravity to do the work for you, the better. So just laying on it, if that feels too intense, putting something in between yourself and the ball, or just moving to another area, starting from the outside in of an area of really intense pain or pressure. And if you're not sure, you're obviously going to be a little bit less well versed in the anatomy than maybe you or I, but you just start at the belly button. That's the best place to start. That's your very first myofascial restriction, you were born with it, and it is necessary in order to close that connection between you and your mother. But if you want somewhere to get started, the belly button's a great spot.
Oh, so that is a adhesion right there, the belly button.
Yeah, it serves a purpose, right? And we need it there. But you'll feel it if you lay on the ball, even if you were to just take like a finger or two and just give yourself some gentle pressure into your belly button, it's not going to feel nice. It's going to feel really gross, actually. And that's what we're looking for, unfortunately. But again, once you allow that tissue to release, it won't feel quite as bad.
So maybe that's a good way to get started, to see how it feels, how it's supposed to feel, and then move along from there and let the body tell you, right? Yeah, I like what you said. So you were talking to me about my neck earlier the other day, and I stretch my neck all the way to the left and then all the way to the right, and you were saying you just want to stretch it until you just barely start to feel the stretch, right? And then a chiropractor the other day told me, yeah, stretching can actually tense it up more. So that sounds like what you're saying now as well, right? If you actually get that full stretch.
Yeah, exactly. It's the same sort of idea. It's like your body's going to brace against anything it doesn't want you to do, right? It's the same sort of idea as if you're driving and a car coming towards you and it's going to hit your rear bumper, you brace, right? That's what your body does when it doesn't want to experience something.
Yeah, I feel that. Yeah, I do feel it doing that. So I'm trying to relax the area. And so you're saying just ever so slightly and then sustained.
Exactly. And like I said, finding ways to let gravity do the work for you is really ideal because then your body doesn't have anything to brace against really because you're always in gravity. But if you're sitting up and you want to do this stretch, 5 minutes is a long time. If you time it, you'll get 1 minute in. You're like, geez, is this over yet? If you can find a way to let gravity do the work, even better. So what I often suggest people do is to keep them from bracing is to take, if you have a bolster or like a foam roller at home, what you can do is just lay on it with it along your spine lengthwise. So you're laying on the floor, put it along your spine lengthwise, and so your head is supported, and then just let your head fall off the edge gently, one side or the other. So then what's happening is now gravity's pulling your head down and back, but it is also opening up all of the structures in the neck and in the upper shoulder part here. So the rest of your body is completely relaxed, and all you have to do is just let your head go. It's quite a nice one, I have to say.
I like that. Yeah, I really like that. So you said lay on a foam roller under your body. Okay.
Yeah, so lay on it lengthwise instead of crosswise, like most people are shown to do with a foam roller. So the foam roller in your spine are parallel and it's directly underneath the spine, but you're also getting some support under the head. The longer the foam roller, the better, because most of us have a spine that's longer and top to tail longer than 2 feet. So I usually recommend if you can get one 3-foot foam roller that's got a little bit more squish to it because it's a little more comfortable to lay on with all your spinous processes poking into it. And then if you don't have that, a yoga bolster works great. If you have one of those round, long, log looking pillows at home that you have maybe on your couch or on your bed, those also work really well.
Okay. Awesome. And I love when we're talking about that gentle, sustained, I don't know if you call it stretch, right?
Pressure or stretch, either one will achieve the same effect.
I think it's easier for me to understand that since you gave us the web analogy, right? If you were trying to pull apart a web without breaking it, you would do very slow, gentle, sustained pulling on that. So I like that analogy a lot. So how does this differ from visceral manipulation? Because that's the term I've been using with, is it different? Is it the same?
Really, it's just the time component. So someone who's doing a visceral manipulation technique versus someone who has myofascial release training doing a visceral manipulation technique, the person with the myofascial release training is just going to be a little bit gentler, meet the tissue where it's at, and also hold for longer, whatever the pressure or the stretch is, wherever area they're working in, they're just going to hold it for longer. And that's where you engage those fascial barriers. So that's really the only difference. The techniques look very similar. They're just with that myofascial background, you're going to hold them longer and with pressure that sort of meets the tissue where it's at.
Okay, that makes a lot of sense. I wanted to ask you about Ehlers-Danlos syndrome because occasionally I'll come across a patient that's very difficult to deal with. Yeah, so is this something that could be helpful for those patients?
Yeah, mixed tissue connective disorders, just in general, they are a tricky one. Sometimes they respond really well to myofascial release, and other times they don't. I often say just give it a try, do a simple technique at home and see how you feel after. If it makes your symptoms a lot worse, it's maybe not for you. But if you feel like it shows a little bit of benefit, or maybe it didn't really do anything, then maybe try going down that road a little further and seeing if there is a potential benefit there.
Okay, so we're not quite sure. It's not like there's a yes or no with that.
No, fascia release is greatly beneficial to many conditions. There's few that I can think of that wouldn't be great, but Ehlers-Danlos and the other connective tissue disorders, those ones are a bit of a wild card. Yeah.
Yeah, okay, good to know. And I'm bringing it up because Ehlers-Danlos is a connective tissue disorder. It affects all the connective tissue and it can make it weak. And so it can cause the intestines to sag so that they're not able to move food through properly. So it can be an issue. It can be something that predisposes people to SIBO. One of the hallmark ways to tell if this might be an issue with you is if you have the double jointedness where you can move your fingers all the way back. So that would be a clue if anyone out there has SIBO or digestive issues, bloating, and you can also move your finger all the way back. You would want to look into that.
Yeah, that joint hypermobility, it's not pretty, but also it doesn't do great things to the digestive system. Yeah, sometimes with that sort of issue, it's not always going to present in the same way. And just because you have mixed connective tissue disorder or Ehlers-Danlos or anything like that doesn't mean you don't also have potential myofascial restrictions in other areas of the body that could be altering the system and creating change that's making your symptoms worse. We're obviously not going to try to loosen any connective tissue that's already loose. But if there are other areas that are tight that are creating problems, then we can address those.
That makes perfect sense. I'm very interested because you're in Canada, so it's not like I can go physically to your center very easily, but you do have an online program, right?
That's right. Yeah. So last year we developed a sort of DIY myofascial release program. We call it Freedom from Pain. And it essentially is a number of modules that show you, based on region of the body or based on symptoms, what sorts of techniques that you can learn to do self myofascial release or self release. And we show you with videos, and we have graphics and demonstrations. And so we'll share how to find the right tools at home to use if you don't have the ones that we're using, and what position to get in, what you should feel, how long you should be working in an area, and tracking your progress as you go so that you can see where some difference has been made and where other areas still need some attention. So yes, it's a great course. It's very hands-on. It's practicality. And we also have opportunities in there for you to have a consult like this where we're on the screen and you can troubleshoot with us, where maybe you've tried a few of the techniques and you're getting some benefit, but you're not sure if it's optimized. We can help you with that as well.
Okay. So it's general, it's not for digestive, it's general for anywhere in the body it can work.
Yeah, for sure. And the whole purpose of that is really because what works for one person's digestive issue may not work for another person's. It's not that cut and dry, unfortunately. And so we've made it more of a global program because oftentimes we see that if somebody deals with an issue that they're feeling that may seem unrelated, they may actually see that crossover benefit to other issues that they're having anyway. And so it's worth giving a try, even if you're not necessarily focused on the gut area.
Right, because integrative health is about the whole body, right? We all have a body, everything's connected. So I love that. We will definitely put the link to your program and your website in the show notes so people who are listening interested in this for their digestive health or just in general. And I might be one of your customers too, because I'm obviously very interested in getting this figured out for myself. So thank you so much for joining us today. Is there anything else you'd like to share with our guests before we close?
Yeah, we often share little tips, little snippets of advice on our social media. So if you'd like to follow us on social media, you can find us at Myofascial Mississauga. It's a really tricky one to spell, so you can also try at Myofascial Canada. We have an account there too. And yeah, definitely check out the course and see if it might be a good fit for you, because while we're in Canada, we'd love to be able to help as many people as we can.
That's awesome. Thank you so much for this information. This is wonderful information for our audience, and I hope we have a chance to connect again in the future.
Likewise.